Our new PM&R department here at WVU is the first that we've had in the state. Really, the mission of our department is to provide rehabilitation care to patients in West Virginia. We have catastrophic injuries where patients have suffered traumatic brain injuries, spinal cord injuries, strokes, and they're left with really disabling conditions. So as a physiatrist, we help treat those conditions so that they can enjoy their quality of life. I work mainly in the concussion clinic here at the RNI, so we take care of patients who've had concussions, which are mild traumatic brain injuries, but I also see moderate and severe traumatic brain injuries. When I first meet the patient, I see them usually on the inpatient rehab unit. So this is very shortly, within weeks usually after injury, and I treat them there. And our goals there are to really get them to improve and function better to get them home. And then starts the rehab journey as an outpatient. And I usually follow my patients all the way through their care. We work very closely with physical therapists, occupational therapists, speech therapists in treating our patients. And we also work very closely again with our neurosurgery, neurology colleagues in treating these patients. So it really treats the patient as a whole so they have better outcomes. With a brain injury, they have issues that aren't really seen on the outside by other people. They'll have headaches or they'll feel dizzy, and your brain also just takes a really long time to heal, and it's using a lot of energy. So patients are tired and they just can't function the way that they want to function. And so working them through the therapy and they will tell you, how much better they're getting. And you can see it in the patients when they come back to the clinic. I can usually see a patient when they come back, and I know they're feeling better just by the look on their face. The deficits and disability are much more severe in somebody who's had a moderate to severe traumatic brain injury. So there is somewhat of a different approach because I always go in, assess the patient, and then the very next thing you ask is, what are your goals? And so then we kind of hone in on what are the goals and how are we going to attack these goals to meet them. Because that's really what it is. Patients come in and they just don't feel like themselves. They'll say, I just don't feel right. That's really the rewarding part of what we do, is really seeing people at some of the worst times in their lives and then seeing them make progress a little bit each day by day, month by month, year by year. It takes a long time to get better from these injuries, so it's just extremely rewarding.